let's talk about two quick screening tests that you can do at home to help figure out whether or not your dizziness and balance disorder is connected to an inner ear issue. Now, this is a screening test, so it could be either the inner ear system isn't functioning as it should, or the brain isn't interpreting that information as well as it should. Either way, we're going to go over two quick screening tests, and I want to talk about, before we get into those tests, kind of the method behind it. So you have your feet, which is your somatosensory system, your vision, and your inner ear, which is the vestibular system, all help you keep upright and stable and balanced. And so how we can determine whether or not you're using one of those systems well is by taking two of them away. So this first test is exactly that. You take a couch cushion or a pillow, you find a corner wall, put a chair in front so you're safe. Now, before you're going to stand on that cushion, but before you do, I want you to just stand with your eyes closed, and that's going to be your baseline. So at this point in time, you're able to use your feet for your balance, and you're able to use that inner ear system, the vestibular system, but we are taking away your vision. And so that's going to be your baseline, and then the next task, do that for 30 seconds, is going to be standing on the cushion doing the same thing. So you're going to stand on that cushion, you're going to close your eyes for 30 seconds, and I want you to pay attention on whether or not you are having more sway or more difficulty keeping your balance than you were when you're on solid ground. So if it's significantly more difficult, then that could indicate that you're not utilizing your inner ear system as well as you should, or that inner ear system is not functioning as well as it should. So that's the first test I want to do. When we do that test, we are counting 30 seconds, seeing if you're able to do it. This is more of just a screening. I'm just looking for kind of that quality, how well you're able to stay still. So it's just kind of subjective. Are you moving more than you were? Now, the second test is going to be walking with your eyes closed. Now, I suggest you do this with somebody at home that's able to help prevent you from falling if you're having balance issues or running into something. But you're just going to close your eyes and you're going to walk straight line. Now, what I'm looking for is, one, are you walking slower? And two, are you going off to the side? So if you are kind of going off to the side, listing or drifting off to one side, it's possible that one inner ear system is functioning a little bit better than the other one, and it's pulling you that direction. So if you had a weakness in the left inner ear, then I might expect you to, not always, but might expect you to walk or drift off to the right. If you had a weakness in the left inner ear, if you had a weakness in the right inner ear, then I might expect that stronger side to kind of pull you, drift you off to the left. Now, if you have bilateral loss, so loss on both sides, then you're just going to be really unstable and imbalanced when your eyes are closed. And you're probably noticing that in the shower or dimly lit areas, stuff like that. But those are two quick tests that you can do to kind of guide you in the right direction of, okay, well, maybe this is an inner ear problem. It's not completely definitive, but they're pretty good quick screening guides that you can do at home easily, as long as you set it up safely.